Hello, everybody. Hope everybody's doing well. We'll get started in a few minutes. Just letting everybody join. Thanks. All right. I guess I could go ahead and get started. Can everybody see my screen?
Yes.
Yes.
All right. Great. All right. So welcome everybody. Welcome to another edition of Connecting with Clinicals. This is an event put together by CSGA. This time it was EM's turn to, basically pitch EM. So first of all, my name is Rishi Patel. I'm a fourth year medical student, and I'm also the current president of the clinical Ross Emergency Interest Group. There are also other e-board members here tonight. I see Tamika, I see Shanice, Bryant, Michael. Yeah, there's a lot of people here. So at any point, if you guys have any questions about anything, feel free to put in the chat. I'm sure they'll reply as well. And I'll try to keep an eye on the chat and as we go along. All right. So
I think you're muted.
oh wow, I was talking. I was yapping for like 5 minutes and nobody heard me. I'll go back. Sorry. Uh, welcome everybody. I don't know what the last thing you heard was, but this is CSGA's Connecting with Clinicals event, this time Remake edition. My name is Rishi Patel. I'm the president of CS Remake this term. This is more of the e-board. There's some of the e-board members in chat. So if you guys have any questions, feel free to first interrupt me and ask any questions that you have, or you can put it in the chat and I'm sure some members will answer. This is more of our e-board. Okay, so this is our clinical advisor, Dr. Michael Galushka. He's the program director and the student clerkship director at Kahneman Memorial in Johnstown, Pennsylvania. We also have some great alumni from Ross that are residents there now. So it's a great hospital, great faculty, great residents all around. All right, so why emergency medicine, right? Like what makes it so special? Like what's so special about emergency medicine that attracts a lot of people? So first of all, we have undifferentiated patients. So it means like most of the time, EM physicians are the first to assess a patient, and every differential has to be considered. Like no matter what, like you have to consider A through Z. Second thing is like there's a quick rapport. You have to build a quick rapport. Most of the times, you're seeing patients that are most likely having the worst day of their lives, and in that moment, you have to be able to connect, empathize, and then help them feel better. And the quote I like to use is, "You're the calm in the storm" in that situation for them. So, and the other thing, critical decision making. You have to make this management decisions based on your clinical assessments, and often without a complete history or testing. And multitasking is a big thing in EM, and it's also called distracted decision making. And I like to throw an example of, I don't know if you guys are familiar with the show The Pit on Max. It's a show about emergency medicine. Basically shows the chaos that goes on in the ED. And I really recommend this show because it covers it really well. And it's very medically accurate. It's amazing to see. But one thing that kind of I didn't like was he's wearing his stethoscope backwards. So yeah. Anyways, teamwork is very important in EM. Being a leader to your team, you have to remain calm and composed in stressful situations. This inspires confidence in your colleagues. And you were you saying something, Ryan? Sorry. Okay. All right. Procedures and skill sets. You have to be proficient in CPR and airway management, basic suturing, to even critical vascular access, central lines and stuff like that. Work-life balance is a big thing in ED. You have shifts that you work, and then after that, there's no call in most cases. So, and it's ever changing. Every shift is different and unpredictable, and medicine's always evolving. So you learn and gain new skills throughout your career. And some of the challenges of EM physicians face is mostly the EM has its own set of emotional, mental, and physical challenges. You have to be able to quickly evaluate, treat, counsel, and come up with a disposition, all while maintaining a great quality of care, right? And that can be stressful. And one of the most stressful situations you can be in is burning out. There's a study from, I believe, 2018. I might be wrong. It said that 65% of EM clinicians report signs of burnout, and it's the highest. EM has the highest prevalence of burnout among all specialties. And one of the things we saw from that was the case of Dr. Lorna Breen. She died by suicide in 2020 during the COVID pandemic, and after that, there was a bipartisan bill passed called the Lorna Breen Healthcare Provider Protection Act of 2022, and that basically provided over 250,000 healthcare workers with mental health resources. And just I wanted to add this because this means so much to me. The bill itself is up for reauthorization. So if you feel strongly about this matter, like I do, please go to this link and you can send an email to your representative, your local representative, strongly encouraging that. Next, the pandemic. Obviously, EM was at the forefront of COVID-19. and it was a big deal because emergency medicine is the doorway to the house of medicine, right? And the door never closes, no matter what the circumstance is. The ED is always open. All right. So I'm not sure which years you guys are in, if you're in your basic sciences or if you're in your third year, fourth year, but I wanted to cover some um, information about your preclinical and clinical years. So mainly your second, third year. Um, One thing, obviously, study hard when you're in med school. You want to get step one out of the way because it can be an obstacle sometimes. Um, and if you put in the effort early in your med school, you will reap the rewards later on, and you can have a really comfortable last half year at school. You want to do well in your clerkships, right? Um, you want it's reflected in your MSP. Your MSP statements are literally the comments from your medical or your attending on how you did in your clerkships. That's regardless of grades. This MSP is just the comments itself are important, and you want to take away a skill from each rotation. You want to, like for example, suturing from surgery, patient presentations. All those skills are big in EM, and you want to try to gain as many as possible. You also want to start exploring EM early. You want to try and get involved as much as possible, whether it's REMIG, like our interest group, or you can join other organizations like EMRA, AEM, RSA. Those are great resources that you guys can have. And fun fact, if you sign up for EMRA, you will get sent so many guides. Like I have the student advising guide. You have fundamentals of EM. You have antibiotic guide, CPR, everything. And most of the material I cover in this presentation, it's from the advising guide. So it's a great resource. It can be a little expensive, but I assure you it's really worth it. You want to try to find advisors and mentors as soon as possible. And this was very stressed when I was coming up into my third year. And we actually at Remake, we started a mentorship program. Um, and if you scan the QR code, you can become a mentee and we'll pair you up with either a fourth year or or a PGY1. It just depends on which mentor is available. But I think in my personal experience, mentors are really important, especially being an IMG and going into EM. I think it's really important. And conferences are a good time, and much more than that, they're great connection events. I met so many great faculty through conferences. I was at ASAP last year, and I believe some of the people here today were there as well. We made some great connections, had a great time, and we learned a lot. We were in intubation labs, ultrasound labs. There were so many things to do at conferences, and plus it's like a holiday. Like this year, it's in Miami, so you know, it's a vacation basically. Um, you want to try to find research and volunteer opportunities. I mean, research you can find at your core rotations. Volunteering you can find in your community. So in Miami, where I'm from right now, we do beach cleanups, we do soup kitchens. There's a lot of things you can do, and it just goes on your resume, but it also shows that you're active in your community, and that can be very valuable. Connections, like I covered earlier, like in conferences, you meet with faculty, other students, you hear from them, hear their experiences, you get advice. It's invaluable, in my opinion. And you want to start planning for your EM rotations because being from Ross, we don't have the same advantages that a USMD will have. For example, like the VSLO program, we don't have access to that. So we have to reach out to programs on our own and fill out applications, send in our personal statement, um, our CVs, everything. We have to do it ourselves. Sometimes Ross, you can use the My Ross and sign up for some electives, but most of the electives that we have for EM are through the programs themselves. So it can be a hassle sometimes. It'd be a lot more access because you have to get those electives approved, and it can take months. So you want to start planning where you want to go. Okay. In this part, I guess there's other students here that have done EM rotation. So if I am wrong about something, or if you want to add something, please feel free to interrupt me. So some of the expectations you may have on EM rotations, you have to be on time or even early. I encourage people to be early because, you might get stuck in traffic or something might happen and you show up late. And just looks unprofessional. And it shows lack of enthusiasm. It's a good idea to always figure out commute times before your first shift. So maybe a day before, if you have time, just make the drive from your housing, especially on away rotations. You're not familiar with the area. You just want to figure out how long it's going to take you, right? You want to be enthusiastic. You want to have a passion for learning, and that's where you're doing the rotation, right? Especially in elective, where most likely, if you're doing an EM rotation, you want to do EM or at least are exploring EM. You want to be enthusiastic about it, but you don't want to be over the top. You don't want to be, over the top. I don't know how to explain it better than that, but you just want to have a passion for learning in every situation, and you want to be prepared. You want to bring your stethoscope, trauma shears, 2 pens, because you always lose one. Somehow, one always goes missing. And you want to use pocket EM guides or medical apps for quick references. You want to add something, Shanice?
So Emra actually had a student forum yesterday where a lot of the program directors described doing too much as constantly interrupting or being difficult to work with or not receiving feedback as students that were when they say you're doing too much. And when they describe being on time, they described it as being there and logged in and already reviewing patients, not just walking in when everybody else walks in. When they mean being on time. That is all.
Exactly. You don't want to be slacking. You especially if you're you want to make a good impression because most likely you are trying to make a good impression if you're there. So you want to do everything you can to not look bad and be there ready to go when they walk in. And patient interactions, this is self-explanatory, but you want to introduce yourself, explain your role as a medical student. Um, you want to find out who's accompanying them, and you do not want to make assumptions under any circumstances. You ask who they are, how they're doing, etc. You want to build a rapport with them, but you also want to maintain efficiency, right? You don't want to spend 20 minutes talking with the patient about something other than their medical history. It's fine to chit chat a little bit to build a rapport, but you also want to stay on track because you have other patients to see, most likely. If the patient's unstable, the first thing you do is alert your resident or attending immediately. You do not wait. If the patient's coding, you get help. You will hear this again if you go to any event that's about any rotations. You will hear this over and over again. Go to your resident or your attending first. Yeah. And speaking of patient presentations, it can be a little challenging in the ED because they're different from what you may be used to in IM. You want to be critical, or it is critical to demonstrate your knowledge in the patient's chief complaint exam and their management. And you want to be thorough, but you still want to be brief. So you want to stay on the pertinent information. You can exclude some of the things that don't matter for the chief complaint, but you still want to be fast. You want to be thorough. You want to cover everything that relates to the chief complaint, and be ready to get interrupted. It happens so much because they have questions um, about what you just said, right? But you still want to stay focused. So be ready to pick back up where you left off. In your presentation, you basically include the chief complaint, obviously medical history or symptoms, but only those that are pertinent to your chief complaint and the relevant exam findings. So you don't want to ramble on about something completely different that don't have anything to do with the chief complaint or are not even, slightly related. Sometimes you can mention it, but you just want to stay on track. You want to develop differential diagnosis and your management plan before you present your patient. Um, One thing I would recommend is before you present your patient, run it by a resident at least the first couple of times just to see how you did. And you get feedback, you improve, and then you look good when you present to the attending. So you want to consider, for management, you want to consider all, or differentials, you want to consider all the possibilities. Again, cover everything, rule out everything. Um, the advising guide from Emra has this really good mnemonic, spit. You probably heard it before, for differential. So one serious, one probable, one interesting, and one treatable diagnosis. This could be your 4 differentials. And you can always use MDCalc. MDCalc has saved me so many times. All these scores, nobody remembers everything, right? Your heart score, your CHADVAS score, whatever, like you're not gonna remember everything. GCS, who remembers GCS off the top of their head, right? So it's like MDCalc can save your butt sometimes. It's really fast, really easy. You can bookmark everything. It's perfect. And be ready to answer any questions about the patient. Anything like medical history, physical exam. If you don't know anything, say, I don't know. I'll go ask them or I'll come back to you. Don't lie. Basically, that's my point. Be ready to discuss any disposition for your patient. So when you're presenting your patient, you should already have a differential and where you want the patient to go, where you want the patient to go. If you're admitting them, if you're observing them, whichever it is, you should have an idea. And it's okay to be wrong. That's why you're there. You're learning still, right? So it's okay to be wrong. But if you try, it makes you look like you're trying, which you are, and it shows that you're here to learn. And that only looks good. It doesn't look bad at all. And do's and don'ts. So never, ever lie. Like this, don't do it. If you forgot to ask something, say I didn't ask. Don't make up anything. Just say I didn't ask. I can get back to you. I can go ask now, etc., etc. Don't say, or don't lie. Basically, don't overreach. I mentioned this earlier. One of the examples is if your resident or you're attending wants you to do a procedure and ask you like, have you ever done this procedure? Don't lie. Say yes or say no. Sorry. Yeah. If you haven't done it, say no. But also add like you want to learn and you want to practice. It shows your willingness to learn. If you ever ask a hard question, if you get pimped, and you don't know the answer, say I don't know. I'll look it up. I'll get back to you. And that doesn't show incompetence. It shows humility. Like you know where you are. You will learn and you'll get back. You want to own your patients. You want to stay on top of their labs. You want to keep them updated on what's going on. If you've ever been in the ER, you know how long it takes if you're a patient. So they're always anxious. So you want to make sure they're comfortable. You want to stay on top of their labs, keep the attending updated on their case. Yeah. And you want to grow and challenge yourself every day. So if you feel when you start feeling comfortable, try to pick up more patients than you did the day before. But keep in mind, like you don't want to overload yourself. Keep it in moderation. If you don't feel comfortable at all, stay at the same pace. It's okay. But try and challenge yourself sometimes. Communication is very big in the ED. But teams and attendings can change every day. Sometimes you'll work with different people on different days. So if you see somebody new, introduce yourself, identify expectations and responsibilities, ask for any feedback at the end of the shift. Asking for feedback goes a long way because if you don't ask for feedback, they're not going to tell you. And you want to know what you can improve at so you can show them that you can improve, right? So ask for feedback whenever you can. Ask questions. Again, it shows an interest in learning. If you're unsure about something, like why did we do this? Why did we do X instead of Y? Like why are we going this way? You just ask a question. But you want to maintain that hierarchy of power, right? You want to ask your residents before you ask your attending. Just maintain that chain of command. And last thing, probably the most important thing, besides the lying part, be kind. Be pleasant to every member of the hospital, from patients, attendings, residents, nurses, techs, janitors, everyone. You should never be rude to anybody, because it reflects on you at the end of the day, right? So you want to be nice to everybody. I know it's a stressful environment, but you want to maintain that composure. I want to touch on the evaluations. So emergency medicine is one of those specialties um, that likes to use SLOs or standardized letter of evaluation. There are 5 parts to this. Part A is basically your competency, the student's competency or your ability. Um, part B is a norm reference, so it's you compared to your peers or your other students. Um, part C would be also it's compared to your to other students, but it has more to do with how much guidance you will need to become proficient. And then part D is just general comments about your overall performance, your strengths, your weaknesses, what you did, what you didn't do, etc., etc. And the last part is just program information. And these are usually filled out by um, the program director or the director of clerkships, or both. Um, and every program does it differently. Sometimes, I believe in one of the rotations, um, after every shift, you give the attending that you work with the most, you give them a QR code and they scan it and they evaluate you, and that goes into your evaluation at the end of the day, or at the end of the month. Um, there are also different types of slows, and again, other students, you may want to correct me if I'm wrong here. Um, but there are different types of slows. You have an e-slow, which is written by a faculty at an EM residency program. So, for example, Broward Health here in Fort Lauderdale, they have a residency program. So if you get a slow from them, it will be an e-slow, because it's written by a faculty at an EM residency program. A non-residency based slow, which is written by an EM faculty, but they don't have an EM program. So an example of that would be uh, UMCAP, University of Maryland Capital Region. They don't have they don't have a residency program there, but you can get a slow there. It'll be a non-residency slow, but it'll be a slow. And then lastly, you have an off-service slow, which is written by a faculty outside the ED. So it could be anesthesia, surgery. I think internal medicine can. I might be wrong on that. Um, but those don't. The last two don't hold as much weight. So generally, for your application, you want to get a minimum of one e-slow and a one non-residency based slow. Um, Personally, I would recommend maybe 2 e-slows and 1 slow, or just 2 e-slows. Um, and you can Google about this. Everybody has different preferences, um, but you want to at least get one e-slow for sure, and you can get one e-slow, 2 slows, whatever combination, but at least one e-slow is minimum for your application. All right, so that was my uh, spiel, if you will, on EM, and I want to open up the floor to some questions. You can unmute yourself if you have any questions, or feel free to type them in the chat. Yeah, go ahead. Angelique.
Hi.
Hi.
I'm already a clinical student at Ross. I wanted to add a couple of points about, like, just kind of add to some of the things you said as far as not knowing versus knowing, being too invasive and things like that. Um, it is very important that, yes, you are a student, you're learning, but it is important to actually learn. In some places, I don't know, isn't an excuse for things that you should study. You are still required to study. Do not expect like residents or attendings to give you all the answers. Um, I know that that was my experience in a couple of places where like there's things you will not know how to do because you've never touched it, but you should know why you would do it or the indication or have some idea, especially the further you get along in your rotation. So don't make it a habit of being okay not knowing. When some attendings and residents will expect you to have at least tried to read up on it or tried to have learned something on it before you have gotten into the environment, especially if it's a rotation you're interested in or a field you're interested in. So, and then also be willing to help your peers out and be willing to learn from your peers. I learned a lot from my rotation cohorts, and I made sure that anything that I learned, whether it was unique to that hospital or something that I already knew because of my background, that they knew as well if it was going to help them.
Thank you, Angelique. That was very helpful, and I couldn't agree more. You want to have it's a thin line, right? You want to you want to be resourceful. Like you want to be able to uh, you want to perform basically. You don't want to look like you're unprepared in any way, but you have to maintain that fine balance. And you want to be ready before your EM rotations. And before I answer the question in the chat, I just want to add I was talking to a few students, and they shared they had this uh, they brought up that you want to if you're doing three EM rotations, um, you want to do one that like let's say you want to really go into this one program, right? You want to get an ESLO from the University of Miami, Jackson. Don't do that one first if it's your first rotation. Do another one somewhere else, maybe a non-residency slow, so you're ready to work in an ED, so you know how everything works before you go to your preferred program. Uh, Basically, just to look prepared, and so if you're used to just so you're used to the ED working space, right? And the question about how I should approach my third year, if you want to match an EM. Third year is basically you want to focus on your cores. The cores are very important because it sets the foundation. Um, your clerkships are very important. Your cons are very important. Your step two is very important. So, uh, getting a job while you're doing your cores, I don't think you'll have time um, to do anything else. From my experience, and yeah, I would probably say it would lead to burnout because you will be stretched too thin. You won't be able to study much, if any. Um, you might just I don't know if anybody here has done that, but we I don't recommend it. If you want to get ready for EM, um, join join our interest group. We have a lot of resources there. Um, yeah, and yeah, just enjoy your third year and learn skills, enjoy surgery, enjoy IM. Get you know take step two, pass step two, and then you can focus on EM. We do have a list of elective sites for EM. I don't have the link to it, but if you go to our community page, I think I have it. I still have it pinned in there. If not, I'll pin it again. But it's an Excel sheet where the students fill out which site they rotated and how their experience was, and we have a separate tab for e-slow and not a non-residency based slows. So yeah, and you can scan the QR code at the bottom right here and join the community, and it should be pinned in there. If not, I'll pin it after this call. But it's something that we started last year. Oh, thank you for. I didn't see Shanice answered that question. Yeah, Tamika, thank you. It's not recommended. You'll be stretched too thin in your third year, especially. Any other questions? It can be anything. Advice, questions. Anybody here that has not started your clinicals and are looking for like a good place to, if you want to know more about the sites, like Miami or Chicago, Maryland, If you have questions about those sites, we can answer them too. Is it okay if we aren't passionate about research? What can we make up? So yeah, there's, I guess there's no real answer to this if you can make up for it or not. It's okay to be not passionate about research. Just don't be like, don't shut it down. If you get an opportunity, absolutely put your name to it, because it will only help you. Um, but uh, what in terms of what you do to make up for it, I think you can get other activities, like leadership roles or workshops or anything. Anything can make up for it. Really, volunteering, exactly. It would work. Angelique, did you want to add something?
Yeah. So, for those asking about working during rotation, unless you're going to do something, and honestly, it's better just to fill it out, like fill out your rotations before. I'm at CHS in Florida. You don't know where you're going to be from rotation to rotation, and you don't know what your schedule is going to be from rotation to rotation. So, one could be like 9 to 5, another one could be nights. Not many jobs are willing to work with that with you. Um, so I wouldn't suggest it, especially during your course. I do know plenty of people who are nurses or EMTs who have their little side hustles. But unless you have something established and a really good, steady life balance, I would not suggest that. At least not in your core rotations. The next thing, with research and everything else, depending on which site you end up in, just keep your ears and eyes open. If you have zero background in research, suggest your project as far as like doing something in quality assurance or like PDSAs. If you don't know what those are, you can look them up or you can reach out to me. Um, don't try to bite like a whole cow. Like I want to do like, oh, this rare presentation. Those take time, and a lot of time you don't have enough time on your core rotation to actually see through certain types of research projects. Going into internal medicine, I believe most people look at your programs that you're looking in, want like 2 or 3 publications of some form. That can be an abstract, that can be a poster presentation, that can be an oral presentation at like a conference. Research is a broad category. So there's so many opportunities, especially in emergency medicine. And it really just depends on your site. Like at CHS, we're disconnected. So you have to network really hard to get a project done unless you already have some things set up where they have to do the least amount of work to help you with it. I hope that helped for those, um, in a general sense.
Thank you for adding that. That was very helpful. Just to add to that as well, there's another site here, Miami Rescue Mission. When I did a rotation there about 2 months ago, and I didn't find out my location until the Monday of. I didn't get my site till the Monday of. I had to call them and get their schedule so I can start on Tuesday. So that's how late it can be. I don't know how it works in the Northeast, but in the South, that's the general um, time frame, if you will. Um, so yeah, it can be difficult sometimes to manage a job. Don't recommend it at all. And if you're looking for research, uh, there's a there's a group called Caribbean Research Group. If you look it up on Instagram, I'm not sure if anybody here is a member of that, but they have students from every Caribbean school, and there's an application process. I don't know when it opens, but they do a lot of research. And if you're looking for research opportunities, look into that group. And if you get in, you'll have a lot of opportunity for research. And look for case reports. If you have an interesting patient, you can kind of bring it up to your attending. Like, what if I do a case report on this? Is it rare? If it's rare, then suggest a case report. But don't overdo it. Don't ask on every patient. If you see something rare, you can ask, but you don't want to overdo it. And somebody had their hand raised. Now it's not raised. Sorry. Oh, okay. Okay. Really quickly, if while you guys think of any more questions, I want to cover our events that we have coming up. We're doing a collaboration with Surgery Interest Group about during the Trauma Journal Club. It's with Dr. Amber Jones. She's the PD and a trauma surgeon at Kern. This is going to be on March 20th at 7 p.m. The details will follow. We don't have a flyer for it yet, but when we have a flyer, we'll share it in our chats as well as the clinical chats. So look out for that. Remig is also doing a popcorn fundraiser next week. We'll send you more details on that, but it's we did this last year, and it was a great success. The popcorn's really nice, so I'd look out for that as well. AEM, we have AEM coming up in 2025, like I mentioned, or AEM 2025 coming up in Miami. Like I mentioned earlier, it's from April 6th through April 10th. You can register. Registration is still open. I think early bird registration closed last week on the 6th, but you can still sign up for it. And Remig does an AAM scholarship. So it's an application process, and an unbiased committee will pick a winner to get. I don't know the amount, but it's a monetary amount that goes towards your travel, your registration, etc. And then during AEM, we're doing a social, an American Social, because it was social. Get it? American Social is a big restaurant in Miami. It's a really nice restaurant on the water. We usually host like a social night at one of the restaurants in the city. Last year we were at ASAP. We went to a brewery, and Dr. Galushka actually joined us there. It was a great time. So we're hoping to do that again this year, and look out for those details as well. Yeah, and again, join the community, the WhatsApp community that we have here. It's very helpful. We have a lot of residents in there right now, and a lot more being added. Trust me, this in the next 2 weeks. So it's a great place to find resources, get advice, etc. Go ahead, Janice.
September 7th through the 10th, ASAP has their scientific assembly. But on the 7th, the first day of all of their assemblies, they have a residency fair where they put all the residencies in one area for the students to rotate through. So you don't have to go through the whole conference, but it's always good to go to that first day residency fair, September 7th in Salt Lake City.
Yeah, it's usually in like a giant warehouse. Like you can see, like on this picture, this is Emra. That was at the residency fair in ASAP last year in Vegas, and it's so fun. You can just walk around, and all the programs have free stuff for you, like bottles, sunglasses, whatever you want, pens. It's like a trick or treating event. If you're just going there for that, but it's a great connection. Like I met the program director from John Hopkins there. So you'll meet a lot of cool people there. Does anybody have any questions? My presentation was really that good, huh? All right. I guess if that's it, then thank you for coming, guys. SGA is hosting a lot more events. I think the next one is on the 25th. This one is hosted by Surgery Interest Group. If you guys are interested in surgery or exploring surgery, be sure to look out for the link for that. These are awesome events, and if you're unsure about what you want to do, this is perfect to explore. Thank you, Angelique, for your advice. It was really appreciated. Thank you, everyone.
Thank you, everyone. And messages, if you have any questions.